Some other questions then. Somebody asked, are secretomes safer than stem cells? Potentially yes, because they're cell-free, and that means we can avoid some of the theoretical concerns regarding live cell transplantations or uncontrolled differentiation, engraftment issues, or even inappropriate cellular behavior. However, cell-free doesn't mean risk-free. These are, as you know, biologically active materials, and so their safety at the end of the day depends on their sterility, the purification, their sourcing, manufacturing standards, dosage, route of administration, all the things involved in regulatory compliance per se. So, as I've said before, we must be careful not to allow marketing language to outrun medical responsibility. A poorly characterized biological product is still a poorly characterized biological product, whether it contains cells or not. So, what would the risks be, I suppose, in terms of secretomes per se and where they're coming from? I suppose, like all these things, is standardization, contamination. We've seen that recently with eye drops in America where they caused bacterial infections, route of delivery, immune response, disease transmission, regulatory classifications. So there's also a major problem with terminology per se. Some of these products that are marketed exosomes or secretomes may not actually contain what they say on the outside of the packet. As we know, some are plant-derived, some are human-derived, others are synthetic, others are exosome-like particles. And this really matters enormously, whether a doctor, he has to know where they're coming from, where they're processed, whether they're sterile or not. And we've seen this recently in London, Rome, and in Monaco as well. All the different exosomes out there. God, there must be as many as 50 or 60 different ones now that we don't know really what the background between them all are. So I seem to get asked quite a lot still, how do we separate in regenerative medicine science from hype? And I suppose if we ask very simple but very difficult questions, we'll get the right answers. Number one, as we mentioned earlier, what exactly is the source? What exactly is the product? Is it a true secretome? Is it an extracellular vesicle preparation that looks like a secretome? Is it an exosome product? Is it simply a growth factor cosmetic? Has it been independently tested? Is there any peer review evidence? Is there a proper chain of custody? Is it sterile? Is it legal for injection or only topical use? But most of all, are there any controlled human studies? And this is certainly becoming more and more important now as we see the growth and interest in peptides. And I'm really not knocking peptides. I think they're going to be a wonderful addition to aesthetic medicine. But we've seen these ways of enthusiasm before in aesthetic medicine, and the responsible clinician must remain open to innovation but not be reduced by it. There's no doubt about it, a younger generation of doctors accept things easier in this sort of world we live in, the TikTok generation, as they call them, whatever. A lot of the studies that are coming out really are not as good as they used to be. And certainly there's, with the present regime in the United States particularly, you have this whole mistrust of anything sort of scientific, which is horrendous for the industry. So we often know also that topical and injectable procedures are not the same thing. So applying a properly manufactured product intact or recently treated skin is different than injecting a biological material directly into tissue. So anything that has to be injected directly obviously raises a much higher safety and regulatory threshold. You have to have greater evidence around sterility, biodistribution, immune response, long-term dosage effects. So we have to be cautious per se. There's no doubt about it. This is a lovely day in Dublin. We're sort of not used to good weather all the time per se. Somebody else texted me and asked me, how do secretomes fit in with PRP? Yeah, that's a good question to an extent. I suppose PRP was one of the very early practical forms of autologous regenerative signaling in aesthetic medicine, and this is where we brought it to the fore as well. So what PRP does is it tends to deliver platelets, growth factors, cytokines and other mediators from the patient's own blood. Secretomes, I suppose, to an extent are different because they are usually derived from cultured cells, often mesenchymal stromal cells, and they do contain a wider range of signaling molecules and extracellular vesicles per se. And I suppose the interesting question is not necessarily whether secretomes will replace PRP. It may be more how these systems can be understood together. PRP is autologous, familiar, very accessible. Secretomes may be more standard, I suppose, in theory, but only if the manufacturing and regulations are rigorous. I suppose, in my view, looking back historically over the last 20 years, PRP opened the door to biological signaling in aesthetics, but secretomes probably represent the next chapter. They may or may not. So, seeing that we're moving from regenerative medicine almost to longevity medicine, the big question, of course, is, do secretomes have a role in longevity medicine? Longevity medicine is increasingly more, I think, about maintaining tissue function, cellular medication, reducing inflammation, immune balance, mitochondrial health, and certainly they fit into that conversation per se. So a lot of things I'm doing in terms of some of my new books that come out, particularly the pathways of aging, I'm looking at, I suppose, failure between cells, senescent cells, chronic inflammation, oxidative stress, extracellular meltdown. They all alter the signaling in the environment of tissue. And there's no doubt about it. I think people who think that just we're going to take some supplement and live longer, I don't think that's going to be the way it'll work. When we look again at the things that I mentioned above, particularly inflammation, we will get a situation where we will live better and live longer. There's no doubt about it. I suppose improving skin recovery as a procedure is one thing, but claiming systemic age reversal is quite another. We need to keep the claims proportionate to the evidence we have. So that's out and over from Dublin now, and I'll keep you updated over the next few weeks or whatever. I suppose from these balcony talks, this is Dublin per se, and we're just out over the river. Bye.